When it comes to healthcare, innovation saves lives. My next guests are from PATH, a global nonprofit based right here in Seattle, and they're here to talk about the challenges women face around the world and the solutions PATH is creating to improve care. Jessica Millman and Clara Orndorff, thank you so much for being here.
Yeah, for sure. Thanks.
So Jessica, we're going to start with you. PATH, deep roots here in Seattle. For people who might not know about the organization, though, tell us about it.
Sure, that's right. About 50 years ago, there was a small group of local scientists who realized that there was a large gap in access to appropriate technologies and healthcare innovations in people who live in low resource settings. So they started PATH, and our mission is to ensure that life-saving technologies reach the people who need them most. So we do that through three main areas of focus. We develop affordable health technologies, we improve systems, and then health systems, and then we also work to support policies that can improve health. And today we work in about 70 countries around the world, and we are improving the lives of about 64 million people every year.
What fantastic work that you all do. And Clara, you have a big part in finding solutions. So tell me about that role at PATH.
Yeah, so I work in our product development lab where we have the capability to do medical device and health technology design all the way from idea to market. And I also have coworkers who work in our bio lab who do work developing and testing new diagnostic and vaccine technologies.
And we're going to see all of these tools soon. But first, Jessica, beyond creating affordable health tools, what other challenges is PATH really working to solve?
There are nearly 4 billion people who lack access to basic care, which is really a staggering number.
Astounding.
And so we at PATH really work to translate innovation into real-world impact. A great example of that is the work that we've been doing on malaria. So malaria causes 280 million deaths every year, 280 million cases and 600,000 deaths every year. We worked with partners to help develop the very first world's malaria vaccine, and that's now being deployed in countries across Africa. The problem is that vaccines are only going to work when they can reach the people who need it. And we work in places that have very remote communities like the Democratic Republic of Congo. And so we also work on technologies that help to make sure that the vaccines stay at the right temperatures when we're transporting them. And then we work on novel technologies like the microarray patch, which is kind of like a Band-Aid that can be used to deliver a vaccine without needing refrigeration, and it's much easier to administer.
Gosh, and women obviously face different health challenges around the world, like you touched on. Is there any major barrier that really stands out, or is it just getting this to the right people, like you said?
Yeah, like I already mentioned, there are so many people who don't have access to basic care, and women and girls are often the most severely impacted by that. So globally, women actually spend 25% more of their time in poor health, but only about 1% of health research funding is focused on women. So at PATH, we're working to develop tools and services that can really benefit women. A great example is some of the work that we're doing in vaccines and other technologies. So about a quarter of the deaths that happen in children under 5 happen because there are infections that are passed between the mother and the baby. And many of those, like hepatitis B, group B strep, HIV, syphilis, can actually be addressed either by vaccinating the mothers during pregnancy or by ensuring that they get the appropriate screening and treatment. And that isn't happening everywhere. So we're working on developing vaccines, like for RSV and for GBS, that can be administered to the mother during pregnancy. And then we're working on a whole suite of other technologies that can save lives during childbirth or afterwards. And Clara is going to talk about some of those, like the uterine balloon tamponade.
Let's talk about the tools first.
Yes. Thanks. So I have 3 things here to show you today. The first is, like Jessica just said, the uterine balloon tamponade. So this is supposed to address the problem that severe bleeding is the most common cause of death in childbirth. And in the US, for example, we could treat that with devices that cost up to $1,000, which is not practical for a lot of people and places. So PATH and its partners worked to make this product, which is comparable and only costs $7.
Great.
And it's been used so far more than 40,000 times in 25 countries. The second product we have here is this little purple sticker on this vaccine vial. Vaccines are one of the most important medical tools that we have, and one of the challenges with them is making sure that they stay cold. And so this sticker here, this little purple sticker, changes color based on how hot the vaccine gets, and helps healthcare workers know that the vaccines are safe to use.
Great. And then what's this last one?
So it is a bag of rice, but
It is.
about half of the grains of rice are actually a mixture of rice flour with essential nutrients like iron and zinc. So it's a fortified rice blend that Path helped bring to market. And by mixing in these nutrients with locally milled rice, it's this really simple way to get people proper nourishment without really changing the way that people have to cook and eat.
Amazing. Thank you so much, ladies, for being here. So important. Glad that you were able to join us. And go to the website that you're seeing right there on your screen to sign up for the latest news and updates about Path's work.
New Day Northwest is sponsored by PATH,